Hi, my name's Ashley. Interesting fact about myself is that I am really awkward during these recordings, so sorry if I trip up over myself from time to time. So the clinical setting that I was in was an inpatient setting. I was in an acute rehab unit in a hospital, and it was a pretty big hospital. um, so yeah, I was in an acute rehab unit, meaning that the patients were kind of further along in their hospital stay. They were only there for about 2 weeks. Um, so the clinic was pretty big as it was in a hospital, but the actual unit that I was in was maybe like just like a block of the same, like of the people that we were in charge of. There's about 30 rooms on the floor that we were responsible for. I would say rough estimate. Don't quote me on that. But yeah, so each therapist was assigned about like 4 patients unless they were in inpatient. So some of the therapists had to go to the inpatient setting and see like more of the acute patients that were in their hospital stay. Um, and I got to experience a lot of different settings there, so that was also cool. But, anyways, yeah. So there's about 30 people. Each therapist that was working in the rehab unit usually had about four patients. You would see the patients in the morning and in the afternoon. You'd see them in the morning for about an hour and a half, and in the afternoon for about a half hour, usually around 90 minutes, depending on case by case. Um, in the unit, there was like a big common gym area that we would usually do physical therapy in with the patients that we were responsible for. Sometimes you would see them in their rooms, but it just depended what they were, how they were feeling during the day when you go to see them. The gym area was huge. Some people will probably say it's not that big, but from my experience, I think it's pretty large. So when you walked in, there was a little section for occupational therapy. It had like a big table there with like a bunch of fine motor stuff. And then there was a bunch of like the PT side of stuff. So there was like parallel bars and like big old mirrors across the wall so that patients could see themselves when they were walking, stuff like that, doing exercise. There was a big mechanical flatbed that you could do transfer training on. There was like a mock stair set where it had like 3 stairs on one side and 2 stairs on the other just to get gait training kind of a little bit better. Had 2 wooden panels on the side that you could use as railings, so it was nice to have that instead of having to like go into the actual stairwell and train patients how to do that. It was a little more safer. And then there was also like a stepper and like an arm bike and some typical stuff in equipment room. So yeah, that was pretty cool. The patient caseload that I saw was largely neuro, so I saw a bunch of spinal cord injury. Well, not a bunch, but I saw a few. I also saw some stroke patients. I also saw some orthopedic patients who had like hip fractures or femur fractures or humeral fractures, stuff like that. Back surgeries. I saw some cardiac patients too, like some people that had heart attacks and maybe were hurt from that and then had to get rehabbed. So that was the majority of my patient load. So my day to day during clinical, I would go in at 7:15, and then from 7:15 till 8 a.m., I would do chart reviews, and I would look at not only the patient's medical history, but I'd also look at like the other staff notes, so like what speech therapy said, or if like a night nurse needed to help with like a low blood pressure episode, I'd have to read that, or occupational therapy, stuff like that, just to see how the patient is overall progressing and seeing if they're ready to go back home. And then we would start seeing patients at 8 a.m. And then from 8 a.m. till about 12:15, we would be seeing patients, and then we would go to lunch at 12:15. And then I would get back from lunch at around 1, and then from like 1 till like 3, 4, I think the latest I got out was like maybe 5 borderline. And we would see the patients for about a half hour, do some extra stuff. I would stay behind and watch other occupations. I saw some rune rounds, just checking other patients for if they have like bed wounds, stuff like that. So I followed speech therapy, occupational therapy, I also got to see inpatients, so the more acute side of things. I went into ICU and the behavioral unit. Really good learning opportunities. So my day-to-day was kind of variable. So my CI, she wanted me to get the most that I could out of my rotations. So I went and observed a lot of different stuff that had to do with patient care. So 3 myths about my clinical before I went. I thought that I was going to be seeing people that were in comas and I wasn't going to be able to really do anything. It's totally different. I was more so trying to get people ready to go back home. So transfer training, getting strength back up, endurance, stuff like that. The second myth I would say was that no one on the staff would want to talk to me because I was a student. Totally not like that. They're all really encouraging, and I would even follow other staff members some days just to get that experience. So then when I would work with them, you get to create those bonds, and they kind of see how much you care about your degree and what you've been doing in school so far. So it's nice to get that reassurance that someone's seeing your skills and really giving you the feedback that's not only your CI but other parts of the staff, because everyone's different in their treatments. So it was really cool. And then the third myth was that I thought my CI would put me on the spot. It was totally not like that. If she had anything to say about like my treatment session or things that I could improve on, she'd always pull me aside. And if like a safety issue came up or anything like that, she would always do it in a way where it was graceful, and she would just end up taking control and I could step back, and it wasn't really a big thing. So she was really graceful in maneuvering, like not embarrassing me in front of the patient. Essentially, she would always pull me aside and have a conversation with me if need be. So 3 truths about the clinical was that my confidence and my skills were going to go up. I used to dream about the day I could go to clinicals just so I could like zone in on my skills and perfect them. And before I even went, I knew that my confidence was going to be boosted. So overall, I was going to be better at performing my job. The second truth was to treat it like a 6-week job interview. It is so true. You can get so many different opportunities just from trying your best during your clinical rotation and being present in there and putting on your best face. You could really end up with a job afterwards. So that gives you less time on Indeed, and we like that. And the third truth, I would say, I knew I was gonna learn new skills. I didn't think the new skill was gonna be getting around the hospital, because I was getting lost when I first got there because it's so big. But you just ask, and people are there to help you. So I ended up not getting lost, and I found my way around. So I knew that was gonna happen. I knew I was gonna get lost. One thing I did to prepare for clinicals was I was asking all of my professors and all of everyone else about what I should expect, even in like a hospital setting. I had some people that I worked with that worked in a hospital. I work in an outpatient clinic, so some of my coworkers were in an outpatient setting, so I was asking them. I was asking my professors just what to expect, and really just preparing for it and trying to do my best to be there when I am in clinical rotation and not like caught off guard. I was just trying to prepare myself. My biggest takeaway experience from clinical was that I am totally capable of doing my job. Before clinical, I was totally second guessing myself, and this is something that I definitely want you guys to know, is I was doubting myself and how my actual practical skills were going to be before I went to my clinical rotation. But with your CI and getting the feedback and taking notes during my clinicals, I feel like I really can do this, and I want you to take that away from your clinical experience too, is that you are really capable of this. You've been practicing it in class and it's kind of crazy when it actually goes into real life. So you guys are totally capable. You're going to love it, and it's going to be a great experience, and you're going to learn a million and one things, and it's going to be great. And doing it hands-on is 10 times better than the book. Thank you. Bye.